2020 has definitely been a year to remember, with an emerging pandemic more serious than we have ever seen before in history. Here at RDaSH, as is the case across health and care, things have been tough, but our staff have pulled together and shown remarkable spirit in the face of adversity, all to make sure that the people we support continue to receive the care they so critically need. A year of fluctuating changes as the pandemic took hold, wave after wave, meant a context of real uncertainty. Impacts have been on our patients, staff themselves, and their loved ones. The pandemic has shown no mercy. But what this has also given us is a platform to show the power of the NHS, the compassion of our staff, and the capability we have to achieve greatness. This has given us an opportunity to work differently, to remove traditional boundaries standing in the way of delivering the most accessible and dynamic care that we can. The opportunity to work with other providers within the NHS, local authority, voluntary and community providers, charities and private and health and care organisations, working together to provide services in new and innovative ways that will no doubt remain part of our blueprint as we move beyond the COVID pandemic and into the future. In this vlog, staff across our organisation and across the organisations we have partnered with proudly share with us the changes they have made to keep the services going, to adapt the way our services have been delivered, and to respond to the changing needs of those who have needed our support.
During the COVID-19 pandemic, beds were made available at Cedar House to support any patients in Rotherham deemed appropriate for discharge, but who were unable to be discharged due to the coronavirus pandemic. The beds at Cedar House allowed for patients to be safely discharged and allowed increased capacity on the wards.
During the COVID-19 pandemic, we have had the opportunity to develop and launch the Project 3 11 to 19 eClinic app. The eClinic is a free app for all young people in Doncaster from 11 up to the age of 18 years old. The app allows young people to confidentially have direct contact with a Project 3 worker to discuss their issues around contraception and sexual health, alcohol and drugs, and help stop smoking, all through an instant messaging app on their mobile or tablet. The app is available 6 days a week, Monday to Saturday from 11 a.m.
The One Family virtual interagency meetings were established during the COVID-19 pandemic to provide a coordinated interagency response to support vulnerable children and families at this time. The 0 to 19 25% Health and Wellbeing Service worked together with the Children's Centres, Education and other local authority services to identify families who are in need of additional help and support. This included delivery of food parcels, play activities, parenting support and health advice, plus more intensive support when needed at this difficult time.
During the COVID-19 pandemic, we had to think outside the box. We had to work together in order to create alternative ways of meeting our children and young people to offer support and advice. With the increase of social media usage by our children and young people, we thought, what better way than delivering our support and advice via these? Firstly, we had to reach our audience in a fun and interactive way, but being mindful of the restrictions placed as part of COVID-19, i.e. face masks and social distancing, so we created TikTok videos to gain our followers. With the increase in social media presence, this has resulted in children and young people accessing our social media pages, and this has resulted in referrals being received via our messenger service, which we have also attempted to promote. By increasing our presence on social media, we have noticed an increase also in numerical form with increased likes, shares and followers. We hope that moving forward we can continue to engage parents, children and young people via our social media pages to let them know we are able to offer any support advice to meet their health needs.
Health and wellbeing is really important, none more so than during the pandemic, and that's because
we can all exercise together!
During the COVID-19 pandemic, we began trialling AirMid, which is a video consultation programme that links to the system on record. It was something we had to get up and running quite quickly once our face-to-face contacts were reduced and most were being offered by phone call. The health visiting team in Doncaster supported one another to overcome any issues that we faced early on, delivering virtual support sessions and training to colleagues to efficiently establish the use of AirMid. We have received positive feedback from parents who like the personal feeling of a virtual contact over a phone call and the easy setup of AirMid.
One area that I've tried to progress is work around engaging Black, Asian and minority ethnic or BAME communities in research, as these groups are disproportionately affected by COVID, but not represented in research studies. To encourage engagement, I produced a video with the RDaSH comms team, starring myself, my mum, an NHS nurse, and my nan, who's a retired NHS nurse in the Windows generation, to appeal to the community and encourage involvement in research. This video has been shared nationally, and I've spoken about the importance of research on both Tracks FM Radio and BBC Radio Sheffield.
During the pandemic, we have increased our use of social media across all the children's care group. One aspect in particular was opening the Facebook Messenger service, allowing parents to digitally contact our health visitors and school nurses in Doncaster and North Lincolnshire, along with our Doncaster CAMS team. By doing this, we have given parents the flexibility to get in touch when it is convenient for them, which could be late in the evening or at a weekend. Messages range from simple questions relating to their child's health to requests for advice and support, with all messages being replied to the next working day.
So, shutting the doors at Shiloh was a real low point for our service, but with support from the NHS, we've been able to reach out and support our most vulnerable guests in the community. We've been able to buy them phones, provide internet-enabled tablets, provide wellbeing packs to help people with the lockdown situation with mental health, and get Meals on Wheels out to our service clients that are staying in the hotels in the local area. In addition to that, guidance from Dan, who's one of the mental health specialists, has enabled us to move on from just providing basic needs at Shiloh. We can really focus on mental health now and helping people through what is essentially an unprecedented scenario. We're now reaching out to over 90 guests on a weekly basis, making calls with the same volunteers, connecting and helping people with emotional support. It's really helping shape the future of the service as we come out of COVID.
We've been involved with Shiloh in Rotherham, which has also been featured on BBC Look North. We secured winter monies, which were adapted due to COVID, involved giving phones, iPads and wellbeing packs to the guests of Shiloh, which allowed them to keep in touch during this difficult period.
I have been involved in the project and have set up weekly drop-ins for the Shiloh volunteers to provide training, support and case discussions.
Hello, my name is Paula Cafferty. I'm a community practice educator and team leader in North Lincolnshire Children's Care Group. I developed a 5-week virtual antenatal programme during the pandemic for pregnant women and their partners, facilitated by the Health Visitor Service in partnership with the local children's centres, infant feeding team and the midwifery service.
We were directed on the 16th of March to develop a discharge pathway led by community services with a group of multidisciplinary team members from Doncaster organisations. On the 6th of April, we commenced the MDT triage team based within the Opal Centre, where community nursing, therapy, continuing healthcare, integrated discharge team and social service staff all work together to rapidly discharge appropriate patients within Doncaster Royal Infirmary. We identified any additional support requirements to keep the patients safe and well at home.
The original funding from RDaSH led us to secure some further funding from the National Lottery Awards for All to move to the next phase of supporting residents in Rotherham. So now we're looking at supporting people to get out and about in the community. Obviously a lot of people will have anxiety about going back out, so we're supporting them on a one-to-one basis, whether that's taking them to do the shopping or for a coffee. And then we've got a variety of online sessions that they can get involved in too, online yoga and meditation, coffee mornings online and activity sessions. And then the final stage of this funding will be to support people to get back to some form of normality, joining small groups such as walking groups and other physical activity that's good for mental wellbeing.
So ECT is an adjunct therapy which runs alongside traditional oral mental health medications for patients with severe depression. This service is accredited by ECTAS and we have enabled this essential service to continue running for emergency cases throughout the pandemic by working with our partners at RFT, making the necessary adaptations within our ECT suite, and to keep our staff and patients safe. This includes a robust cleaning regime, wearing full PPE, ensuring robust check-in is in place for COVID symptoms. We have worked hard together to ensure we achieve ECTAS standards and adapted our approach by engaging our communications team in order to evidence this.
The Trust SciAP services have fully embraced the digital offer through radically transforming the way of delivering therapy overnight. This has seen the teams moving to 100% non-face-to-face delivery in order to eliminate the risk of transmission of COVID-19 through therapy and embracing digital alternatives in order to do this. Not only have the teams introduced digital methods for the delivery of therapy, but also digital alternatives for supervised practice through recording sessions, digital team meetings, and even pre-recorded sessions to maximise the reach of the service. The radical change in the way of working across the teams is also anticipated to support with recruitment and retention through making the Trust a more accessible place to work.
We set up a digital clinic within Older People's Mental Health Services in North Lincolnshire. We have a clean clinic space and an iPad to use for patient consultations. This is a hybrid approach and a step between full virtual and face-to-face consultation. We're able to offer these types of appointments for our patients who do not have the access or the confidence to use technology at home. They can attend a safe environment for their consultation while maintaining minimal exposure. We've had great feedback so far and are continuing to evaluate to meet patient and staff needs. We plan to share our learning wider. One patient said it was just like being in a room face to face.
Staff across our organisation have done so much, demonstrating courage, resilience, compassion and innovative thinking, all individually contributing to service changes that have proven to be so essential. To this we want to give recognition, an opportunity to share thanks, a chance to take a breath, look back and remember all that has been achieved. As we move now beyond the latest and hopefully last wave, with the hope the vaccination programme now gives to us, we strive to look back and remember this time with balance. The achievements along with the challenges, the growth along with the deep losses, and the foundations from which we will build a stronger NHS and a stronger RDaSH. Thank you for watching.